on the media briefing today. We're going to get started with our first topic, which is about a new state mandates for hospital visitors. And we've got representatives from all of our local hospitals joining us today to talk about how that will impact them and, of course, how it will impact people who are visiting friends and loved ones in the hospital. And I am very pleased to start off the conversation with Clement Miller, who is the Chief Operating Officer at Salinas Valley Memorial Hospital. Good afternoon, Mr. Miller, and thanks for joining us. And tell us a little bit about this state mandate and how it affects the hospital.
Good afternoon. Really what the state mandate did was work to keep our staff and our patients safe. With us having the ability to ensure that our visitors are either vaccinated or have proof of a negative test has allowed us to keep visitors coming into the hospital while making sure our patients were safe. Earlier on during COVID, I'm sure all of you heard of the times where we were limiting or eliminating the option for visitors to come in, which really down the road can hinder the care that we provide. So this mandate has allowed us to make some changes and continue having family members come into the hospital. As our COVID volumes grow, today our hospital has 13 patients admitted with COVID. It is necessary to be able to continue to manage the non-COVID needs of the patients in our community.
Thank you. Thank you very much for sharing that. And I'm very sorry to hear the increase in the number of your COVID patients. We also have Dr. Stephen Cabrales from Community Hospital to talk about this mandate there. And of course, I'm hoping you might be able to update us on COVID patient counts.
Yes, I can. Good afternoon, everyone. Currently, we're in compliance with the state order for visitors visiting. The order, of course, still reading that visitors to the hospital need to present proof of vaccination in one of the various forms or provide proof of recent tests within the past 72 hours in order to gain access to the hospital proper. In order to make this operational as quickly as possible, we've made a couple of changes because of the volumes that we're seeing coming through our emergency department. We are currently limiting or restricting visitors coming into the emergency department so that no visitors are allowed. And beginning on Monday, we will be going down to 0 visitors or support folks coming for our procedure or surgical areas. Right now, we've got 10 patients in the hospital with COVID. One of them is in the intensive care unit, and we've had no deaths in the past, I'd say 2 weeks now.
Thank you very much, Dr. Cabrales. And then also joining us is Dr. Melissa Nothnagel from Natividad Hospital. And hopefully, good afternoon. You can give us some information about this mandate at Natividad and then, of course, patients there.
Yes, we also are seeing that similar increase. We have 11 patients today with COVID. I think 3 are in the ICU. In terms of our visitor policy, I think we are still allowing visitors in the emergency department, but otherwise are following the same restrictions as the other hospitals.
Right. Thank you very much for that. And I was hoping we might have someone on from Me Memorial, but we were just having some schedule struggles. And so if they happen to show up in the next few minutes, we'll be happy to bring them on. But I do want to take questions now for any of the doctors that we have to talk about the visitor mandate or questions you might have about COVID at the hospitals. So this would be the time for questions. If you've got any, please put them in chat. And we're getting some in. Thank you. So I think you may have answered this question, but it might be a good chance to reiterate it for people who might have just joined. What are the most recent numbers of vaccinated and unvaccinated COVID patients admitted to each area hospital? You may have given total patients, but do you have a drilled down number for vaccinated or unvaccinated?
I can start here at Community Hospital. Of the 10 patients that are currently in the hospital, 7 are unvaccinated.
And is there, Mr. Miller, Dr. Nothnagel, do you have any additional information? If not, we can try to get that for them at a later date.
Informally, I was covering the inpatient service last week, and I didn't hear about any unvaccinated patients that were in the hospital, but I don't know an official number, if there are any.
And I don't have an official number either. Generally, we tend to try to funnel all of the information or questions about specific patient conditions through the county.
All right, thank you. Any other questions for any of our hospital representatives on the visitor mandate, or any other questions? I'm not seeing any. Thank you very much, the three of you, for taking part in this. If there are additional questions, we will send them through the appropriate channels to you.
Do you mind if I make one quick comment?
Yes, please do. Thank you.
I just want to make sure that we share that, all of our policies may differ slightly, but it'd be best to refer anyone to our websites. We all have our information uploaded on our websites on how we are managing the visitation process. And each one of them probably has a nuance here and there.
Really good point. And know before you go, essentially, double check wherever you might be needing to visit.
Correct.
All right, thank you all. Wait a minute, hold on. A couple other questions have just come in. Hold the phone. For all the three of you, are any children hospitalized at any of your facilities?
We do not have any children hospitalized. Our youngest patient is in their late 20s.
We also do not have any children with COVID.
Yeah, we don't have any either.
Right, thank you. All right, and the other question I have is not for you doctors, it's for the county, and we'll get to that one. All right, any other questions for our doctors? If not, we'll let those of you who are going, but Dr. Nothnagel, you can't go just yet because you're next.
Great.
Thank you, the rest of you, for joining us. We sure appreciate your time.
Thank you, and I feel like I should clarify, I'm not a doctor, I'm a nurse by training and an administrator now.
Well, you've just been upgraded.
Thank you, take care.
Thank you all very much.
Thanks, everyone.
All right, our next topic is still on the COVID topic, and it's about questions. Last night, the county and Natividad partnered with the city of Seaside for an Ask the Doctor forum, and we got a lot of questions from people. You'd think, everyone would know everything about COVID at this point, but so much is changing. So we brought we're holding on to Dr. Melissa Nothnagel right now because she was the Ask a Doctor at the forum. And I thought we'd talk about what were some of the most common questions that people had for you last night and the responses that you gave.
Sure. Yeah, it was an interesting forum. I think the level of questions that we're getting now is getting sort of higher and higher as people are learning more about the science of vaccines and viruses. It's clear that there's still a lot of misinformation out there on social media that's causing people to be concerned about vaccine safety. So there were some specific questions about a few kind of Facebook sourced myths around supposed research showing dangers of vaccinations that we refuted. We got some questions about the Delta variant and whether our vaccines are effective against that. And it's important to let people know that all three of our vaccines are highly effective against all the current variants. And their effectiveness is really focused on preventing hospitalizations and deaths. I think it's a little confusing now as we're seeing more vaccinated patients test positive or have mild symptoms with COVID. That's not what the vaccines are designed to prevent. They're designed to prevent serious illness and death, and they're doing that very well. There were several questions regarding children, particularly at this time of children returning back to school, and when the vaccines will be available for children. So we let people know that our data does show that it's safe for kids to be back in school, including younger kids who are unvaccinated. It's really important for them to be back in school and getting that social interaction. But it's also really important that we use safety procedures like hand washing and masking indoors and ventilation to reduce infections in schools. Luckily, children are at very low risk for severe illness, but it's important with them being back in school and at risk for getting mild disease that they could bring home, that the adults in their households be vaccinated. Some updates on the authorization for vaccines for children under 12. The research trials are underway. There have been some delays because the number of participants has expanded and the dosing that they're testing has changed. They're doing these studies very carefully, but it means we're probably not going to get results until mid-October and emergency use authorization probably sometime later in the fall.
It's very interesting. It seems like we get the same questions. I'm thinking of the questions that people had a year ago. And so in terms of COVID and the disease, the questions seem to be the same. But of course, with vaccine, we've only, had authorization for the vaccine for a shorter amount of time. Do we know more about the vaccine and COVID now than we did a year ago? And is that helping you as a doctor, say with your own patients, answer their questions?
Absolutely. A year ago, we didn't even have vaccines. They were still in the development phase. It now feels like we've had them for a while, but those of us on the call who are healthcare workers started getting vaccinated in December and January. The general public didn't really have access until just a few months ago, but we've now had so much experience with millions of people receiving the vaccines. We have much more safety information. We can very clearly say from what we've seen with illnesses from COVID versus vaccine side effects, there's no reason to hesitate in terms of comparing those risks. The risks from COVID infection for adults clearly outweigh the risks of vaccination, which are very small. These are very safe vaccines and they work so well. I said to the group last night, I really feel that the speed with which we got the vaccines and how effective they are at preventing severe disease and death is really a miracle. Like, we couldn't have asked for anything better. And so I really hope that people will go out and get vaccinated, because that's how we're going to control this and get through it.
Well, it was interesting because the miracle of the vaccine was actually one of the questions that you were asked, was that the speed of the vaccine caused concern. And I think that's because most of us aren't in the business of vaccine and research. And I think you had a good layman's term explanation for why the method in which the vaccine was created was safe.
Sure. It's a little bit technical, but the nice aspect of the mRNA platform, which has been in development for many years, and vaccines for HIV and Ebola have been in development using the mRNA platform for many years. Compared to other vaccine types, for example, we're all familiar with the influenza vaccine that most of us get every year. That has to be grown in viral cultures. We have to grow influenza viruses that match the strain that we're seeing each year in great quantities, and then grind them up into little proteins that go into the vaccines that then go into our people's arms. With the mRNA vaccines, those can be made by machines. So we can crank out loads of mRNA and make millions of vaccines and send them around the world. That could never have happened with the traditional vaccine platforms like the ones we have for influenza. So that's a really wonderful aspect of mRNA vaccines.
All right. And so for everyone's information, the forum last night was recorded, and I believe will be on the City of Seaside's YouTube page shortly, and we'll get the information out, and so you can listen to all the questions that Dr. Nothnagel answered last night, and listen and share it with others who you think might need that information. Thanks very much, Dr. Nothnagel, for joining us. And I see Dr. Deutsch from Me Memorial has been able to get on the call. And even though the other hospitals are going to leave, we want to grab you while we can. And hopefully you might give us just some insight on what's happening with COVID patients at Me Memorial, and then how is the hospital handling the new state mandate? But you're on mute. You're on mute.
We are seeing a rise consistent with what others are seeing throughout the county. Most of our patients with severe illness are unvaccinated. I have seen 1 or 2 patients who got the Johnson & Johnson vaccine but overall, we're seeing that vaccinated people are still very well protected against severe illness. We are in compliance with the new state mandate so that we allow visitors with proof of COVID vaccination, and for unvaccinated individuals who want to visit our hospital will need to see proof of a negative COVID test within 72 hours. We're in support of the new state mandate, and it's a way that we can keep all of our community safe visiting our hospital, our workers, our patients, and our visitors as well. And I want to emphasize that to us, implementing this mandate is not about creating a two-tiered system or about punishing anyone who's not vaccinated. Obviously, we do support vaccination for many of the reasons that Dr. Nothnagel just mentioned, but it's really about keeping everyone safe, especially the unvaccinated safe, because they are the highest risk of developing severe illness. So we want people, visitors, staff, patients to feel safe coming to our hospital. It was very common during the last peak surge that people were afraid to go to the hospital for major illnesses for fear of getting coronavirus. And so we're balancing both the fact that we feel that visitation is an important part of healthcare. People get better quicker when they have loved ones visiting them in the hospital. So that's important for us. But it's also important that we don't become a source of infection and that people aren't at risk, especially hospitalized patients are at very high risk of severe illness. So we're balancing that by utilizing all of the public health measures at our disposal, which is vaccination, social distancing, hand washing, and negative testing. And we're in recognition of the fact that people who are vaccinated, because they are less likely to get and to spread the disease, are safer to enter our hospital even without a negative COVID test at this time.
Thanks very much, Dr. Deutsch. We had a question for the other hospitals that were on the call earlier, and I'll ask you the same. Are any children hospitalized at Me Memorial?
Not at this moment.
Of course, then that begs the question, have there been any children hospitalized?
Yeah, not to my knowledge, but it's possible that there was, I haven't heard about it, and there were none when I was on service.
Okay. Thank you. We're going to move on to our next topic. Is there any last thing you'd like to tell us as far as COVID or encouragement for people, testing vaccine?
Yeah, it seems that we are in a bit of a surge right now, encouraging everyone who hasn't been vaccinated to get vaccinated. It's an important part of us moving forward as part of the public health strategy. And especially that younger people with the Delta variant, younger people are not as protected as many of us thought that we were against severe illness, that a lot of the patients I'm seeing in the hospital now, 25, 35 years old with significant respiratory distress. So that with the relative protection that many of us younger, healthy people thought that we had against this virus, is no longer the case. And moving forward, every year that this goes on, it may be the case less and less, including increased risks in children. So it's important that all of us remain vigilant, get vaccinated to protect ourselves and our community, and to ultimately support a public health strategy to win the fight against this virus, which the only strategy that's going to be effective long-term is mass vaccination, really everyone, 80-90% of the population, and also 80-90% of the entire world. Hopefully we can all get behind that moving forward.
Thank you. And I did get a question in, and I'm hoping you might be able to answer this. What does COVID look like in a vaccinated person who would be hospitalized?
Yeah, so I saw two, it looks very similar, it's just less likely to happen. So I did have, I've seen two patients that I've taken care of in the hospital with severe illness, both of whom got the Johnson & Johnson vaccine, which still is an effective vaccine, but likely is a bit less effective than the Pfizer and the Moderna vaccine. Any hospitalized patient with coronavirus, there is just a very typical respiratory distress with breathing fast, oxygen going low, And that shortness of breath is kind of the hallmark symptom of coronavirus. So when we talk to patients who test coronavirus positive in our clinic, we always say, hey, you manage this like normal cold and flu. But if you ever develop respiratory symptoms, you think you're having difficulty breathing or chest tightness, that is a medical emergency and you need a medical evaluation. So that's how it presents. We are seeing more coronavirus infections in vaccinated people, and that's likely to become increasingly common over time. I think it's now being established that our vaccine effectiveness will not last forever. Eventually, everyone probably will need booster shots. It's just a question of when. But at this time, is that people who are vaccinated are still very well protected against severe illness, even though infections are becoming more common. We'll see how that evolves in the future.
And I'm sure this reporter would want to know how the patients that you took care of who were vaccinated that had the respiratory issues, did it resolve itself more quickly? If they hadn't been vaccinated, it might have gone down a different path, but because they were vaccinated, it was better, they had a better recovery?
Yeah, well, I mean, that's our assumption. You can never tell for one case. So it's impossible to say for any patient what would have happened in an alternate universe. So the way that we figure that information out is by looking at large groups of people. Is that on the whole, we see that people who are vaccinated have less severe illness. Therefore, it's likely that any individual who had a severe illness with a vaccine, that it probably would have been worse had they not been vaccinated. But of course, you can never say that for sure in an individual case. That's what the overall evidence tells us. And that evidence is actually overwhelming. I mean, the fact that we see so few vaccinated patients in the hospital tells us that the vaccine is really protecting people, and especially, the high risk people, older people. We're not seeing that many older people in the hospital, and one of the reasons may be differences with the Delta variant, but most of it is that older people went out and they got vaccinated, and so they're faring relatively well during this latest outbreak.
Right. Thank you very much, Dr. Deutsch, for joining and kind of giving us a picture of what's happening at me. And then, of course, with the patients that you described, we hope that they recovered and are no longer in your care.
I hope so too.
Thank you very much for joining us. We're going to move on to our next topic now. A little bit, still a little COVID, but COVID mixed with Car Week. And we've got folks who are going to chat with us about COVID safety precautions that are taking place. We've got a lot of people on the peninsula for the wonderful events of Car Week, and a lot of thought and effort has gone into making sure they're safe, as well as some topics about tourism promotion. So we want to welcome Janine Chickarot from the Monterey County Hospitality Association and Rob O'Keefe from the Monterey County Visitors and Convention Bureau to talk about Car Week. And then we'll start with you, Janine, if you talk a little bit about some of the safety precautions, because boy, aren't we glad to welcome all these people back, but we want to do it right, right?
Absolutely. First of all, thanks for having me. And we definitely want to do it right. I mean, our industry took it very seriously from the very beginning in developing our protocols, and the state did as well. And we've continued to follow those protocols. I happened to be at the event in Carmel yesterday, and the car event in Carmel was extremely well organized, to the point where every entrance into the event, you're required to show your COVID vaccine card. And if you had one, they give you a bracelet. If they didn't have one, they were requiring you to wear a mask throughout the event, even though it was an outdoor event. So, I think everybody's at the point now, especially with the Delta, surge it's currently going on, that they're taking this extremely seriously and making sure that they're going above and beyond to take care of our visitors.
Thank you. And then, Rob, tell us a little bit about the promotion that went into Car Week and how it's looking. From what Janine was saying, the car lovers are back.
Yeah, it's definitely back with a roar. The event promoters have really taken seriously the safe and responsible messaging that we've been promoting since COVID began. We work with most of the event promoters in order to understand, what are their protocols, so that we can push that information out to people who are traveling here. Our primary interest is letting people know what to prepare for when they come here. And so we put a lot of messaging about COVID safety and responsibility to type content out so that they know what to expect when they get here. And then we're also doing a local promotion so that we're reminding people when they're here. And I know that the hotels themselves are also reminding them. So people traveling here are getting hit with the safe and responsible messaging before they get here and then repeatedly when they're here. And the promoters themselves have really taken it to heart. Some promoters are actually doing fast testing or requiring vaccinations, or you can't even get in. So it makes for a much safer event. And of course, that's what we want to be seen as. We want to be seen as a county that has embraced safe and responsible and will continue to do so, so that people feel comfortable coming here, because safety is still a major concern when people are picking where they want to go. And just anecdotally, having attended a couple of events myself, it seems to be working. People are really taking it seriously.
So both Janine and Rob, it sounds like, Janine, your description of, the lines to get in we haven't heard of any people upset or leaving any event because they had to wear a mask or be safe. Have you heard of any problems?
No, I haven't, and that's wonderful, to be honest with you. And it moved very smoothly. I mean, people were entered very quickly, and it ended up just not being a big deal, quite frankly.
Yeah, and it really, we've seen the numbers aren't quite what they historically are. We're missing a very important component to Car Week. That's the international traveler, because they can't get here. That demand is being somewhat backfilled by other travelers who are coming here. We'll get the international visitor back next year. And I think, for the most part, hotels are doing okay. Janine could certainly speak to that with more detail than me, but we talked to a number of different hotels, and we're seeing not quite as robust, but pretty close in many instances in terms of the number of visitors.
Yeah, that would be great, Janine, if you could tell us, what you know about, visitors in the hotels.
Sure. Actually, specific to Car Week, we actually have had a very robust group of people that have booked that are excited to be back here for it. But as Rob mentioned, the international traveler, once the Biden administration announced the restrictions again, we several of us took a hit in terms of those international people canceling. The good news is that the domestic travelers are still interested in coming for Car Week, so we were able to backfill a lot of that business. So that part's been great. The peninsula and in particular, it looks like it's been just extremely busy, and it has been, but it's been 100% leisure travelers. So it's been almost off the charts in terms of leisure travelers and the demand, and they're actually paying higher rates, which is great for our city and county. And it feels like it's back to normal, but it truly isn't. We are within the last couple of weeks with the resurgence, the group business is falling off. People have contracts in their hands, or now they're not signing them. They're wanting to maybe push their business into next year. So that group business that usually sustains us through the fall is not where it needs to be. So we are going to feel a softness in the community once we get through Car Week and into the fall, and definitely into the winter.
Yeah, and I would just echo that. I can put some numbers behind it. As of July, we were 81% below where we normally are with group business, which is a huge gap. And to Janine's point, the group traveler coming here for meetings and conferences, they spend 2 or 3 times what a leisure visitor spends, and a little bit lighter footprint on the destination too. So we're working hard to get them back. There's still some uncertainty related to that, with some of the other counties and other parts of the state. For us, it's a critical component, and I think we're going to see a drop off in the fall. We're just hoping to try to avoid that as much as possible.
Is it possible that leisure travel might uptick in the fall and help you out with that loss of business, or we just kind of don't know what to expect yet?
I think it's conceivable that the level of leisure travel will help, but I don't think it's going to replace that critical target. What do you think, Janine?
Yeah, I tend to agree with you, Rob. I think with children going back to school, That's a variable that's going to play into this. And, it may be the patterns will be busy on the weekends, and then softer during the midweek is something that I'd anticipate seeing.
Right. Thank you both. If anyone has any questions for Rob or Janine, this would be the time to go ahead and put them in chat. And so I've got questions that have to do with variant data, but I don't have any, unless you've all got doctors. If now you're becoming doctors, I don't have a question for you two, but I do have a question for the health department, and I'm going to have to refer that to the health department. And I've got some other questions for county administration, which I will forward your question on that. Any questions for our hospitality folks? Seeing none.
I'd just like to thank the county. They actually recently sent out some additional information for us to post in our businesses about, social distancing, wearing a mask, and washing your hands. And it's a 10-point flyer that they created for our industry. And I just wanted to give a special shout out to the county for putting that together.
And we'll give a shout out to our consultant who really made that happen. It really helped us out. If that is all the questions for everyone, I'm going to wrap up the briefing for today. Thanks everyone for joining us. Our next briefing will be next week. We'll see you then.
Thank you.
Thank you.